This segment sponsored by the Springfield Clinic.
We're joined by Rajan Kochar with Springfield Clinic Gastroenterology to discuss colon health. So tell me, who is at risk of developing colon disease or colon cancer?
Good morning. Thanks for having me. Everyone is at risk for getting colon cancer. It's one of those cancers that can be seen in everyone as they age. So anyone over the age of 50, we recommend get screened, as that is the age that the incidence really starts to go up.
Yeah, and when should people start getting colonoscopies?
So an average risk person should start at age 50, but there are some people who might be at higher risk, and they should start earlier. People who've had colon cancer in the family, or people who've had colon polyps before, those people need to start even sooner. Typically, if you've had a family member, a first-degree relative, which is a close family member with colon cancer, you start 10 years before they were diagnosed. So if my dad, God forbid, had colon cancer at age 50, then I start screening at age 40.
And are there any other risk factors for people with colon cancer? Anything else?
Yes, so having a family history is one of the big ones. Age is another one, as I mentioned before. There's other risk factors, including smoking, alcohol use, obesity, a diet that's high in processed foods. All of those have been known to contribute to the risk.
And what can someone do to promote good colon health and stay healthy?
I think people need to be talking about this. Oftentimes, it can be an embarrassing thing to discuss, but anybody who's had a colonoscopy, who's been found to have polyps or has had colon cancer in the family, should encourage others. March is Colon Cancer Awareness Month, so we use this month to propagate awareness even more, even though I like to say that in our gastroenterology world, every day is colon cancer awareness, because that's one of the big things we do that has a big public health impact.
Yeah, and how often should someone get a colonoscopy or get, their colon checked?
That varies. If someone has average risk for colon cancer and their colonoscopy turns out completely normal, then they can wait 10 years before having another one. However, if you are at high risk for colon cancer because of family history or you've had polyps before, then you may have to come back sooner, typically in 5 years or 3 years, depending on how many polyps you were found to have.
Well, some great advice there. Thank you so much for speaking with us this morning.
You're welcome. Thanks for having me.
Thanks.